Good morning once again. This is Dr. Bhupesh from Dr. BKM Institute. Our contact number still is plus 917696734256. As mentioned previously, if anybody tells that that we are collaborating with this institute, please confirm from this number plus 917696734256. We are not working with collaboration with in collaboration with anyone unless you kind of confirm it from us. So please be aware. And second thing, we are talking about this particular thing, the speaking of today, how to do OET speaking. So it's like accident and emergency case. So in the exam, even I have not read this topic, so I will read it with you only so that you all can understand in the best possible way. So it's like an accident and emergency department. You are an AE nurse. So basically, I'm a nurse in accident and emergency department. A young man, woman has presented at this. So it can be a man or can be a woman. So whatever your examiner is, if she is a lady, you talk about she. It would be easy for you. So if he's the male, then you will say that, all right, sir, you're gonna be fine. So you can take the patient as man or woman because the examiner will act as a patient. You will act as a nurse. Examiner patient की तरह act करेगा और आप nurse की तरह act करोगे. A young woman has presented, तो examiner बिल्कुल यही patient होगा जो with thermal burns के साथ आया है to his or her forehead. तो she is hysterical and is demanding immediate medical attention. Hysterical is like maybe थोड़ा बहुत जैसे होता है hazy types, but again I don't know the exact meaning of this thing. So even in exam, if something like this comes, don't worry. So try to ignore this word rather than getting worried about it. Hysterical वैसे भी जो part है वो उसकी feeling है, वो जैसा उसको लग रहा है. तो जो वो फील कर रहा है, जो उसको लग रहा है, वो खुद एक्सप्लेन करेगा. तो अगेन आपको यहाँ पे अपनी कंसंट्रेशन लूज नहीं करनी होती और डरना नहीं होता कि यार मुझे ये वर्ड नहीं आता, क्योंकि हिस्टेरिकल इज हिज फीलिंग. तो हमें इस वर्ड से वैसे भी लेना देना नहीं है. वेदर इट कैन बी डायलेमा, इट कैन बी अदर थिंग्स एंड इज डिमांडिंग इमीडिएट मेडिकल अटेंशन. इट कैन बी स्केर्ड, ही माइट बी स्केर्ड. तो यहाँ से पढ़ने में ऐसा लग रहा है इमीडिएट मेडिकल अटेंशन डिमांड कर रहा है, तो मतलब वो थोड़ा सा स्केर्ड है और थर्मल बर्न्स हो रखे हैं. Explain the likely treatment, give an analgesic injection ointment to prevent. So basically सबसे to prevent burning, वैसे ये पूरा सेंटेंस नहीं है शायद. तो मेन बात है सबसे पहले ointment लगानी है और analgesic injection देना है पेन रिलीव करने के लिए. Explain the likely treatment, तो explain करने को कहा है, देने से भी पहले explain करने को कहा है. तो मैं OET के हिसाब से चलता हूँ. इन एग्जाम I will go according to what the task has been given to me. So it says explain. So I will say good morning, my name is this. So he will say, oh nurse, I don't have time to say good morning. I have got this, burn on my forehead. I need immediate treatment. Please provide me immediate treatment. So say, okay, I understand. And please calm down. We are here to help you. Please relax yourself. And I am just going to explain you the treatment. It would be an analgesic injection that will immediately relieve your pain. And this ointment will help you to prevent your burns, and it will help you to relieve it and you will feel better. Find out about the injury. So first point would be this, that you would be as a nurse telling कि आपको इंजेक्शन लगाएंगे हम और ये करेंगे, क्योंकि एक्सप्लेन करना है. तो find out more about injury, infection, cover with gauge, painkillers for home. So आप उसको कहोगे कि हम इंजरी के बारे में पहले तो आपको फाइंड आउट करना है कि इंजरी. सो यू कैन आस्क नाउ. सो यू से दीज आर द ट्रीटमेंट. सो कैन आई गिव यू दिस ट्रीटमेंट. सो पेशेंट कहेगा ऑफ कोर्स इमीडिएटली गिव मी द ट्रीटमेंट. देन यू से ओके, नाउ आई हैव गिवन यू एनाल्जेसिक इंजेक्शन. तो ये आप अपने आप फ्रेम करते हो कि मैंने आपको दे दिया है, प्रेजेंट परफेक्ट. नाउ आई हैव गिवन यू analgesic injection, that means pain reliever, so you will not feel any pain. And also I have applied, कर चुकी हूँ, present perfect. So I have applied the ointment and now you will feel better. पहले उसको बताओ, फिर वो कहेगा nurse I don't care, don't tell me, just do that. So you say okay, calm down, I am doing that. Okay, now I am doing that, मैं कर रही हूँ. फिर आप छोटा सा पोज लोगे. नाउ आई हैव गिवन यू एनाल्जेसिक इंजेक्शन, सो पेन रिलीविंग मेडिकेशन हैज बीन इंजेक्टेड एंड आल्सो एट द सेम टाइम वी आर गिविंग यू ऑइंटमेंट टू प्रिवेंट दिस थिंग. फिर उसके बाद आएगा find out more about injury. So now as I have given you the first aid treatment, so I would like to know how did it happen. तो ये आप पास्ट में पूछते हो कैसे हुआ. तो इस टेंस के आपको बहुत मार्क्स मिलते हैं. how did it happen, हुआ कैसे आपको. So then patient will tell you, oh, this and this and that. Okay, so you say okay, so I have given you these things. Now you need to take care, you need to prevent any kind of infection. So I'm covering it with a gauze, and also I'm prescribing you some painkillers, so that needs to be taken in terms when you have pain. So whenever you have pain, you take the painkillers. And also I'm covering the wound with the gauze to prevent any kind of infection. So empathize with him about her concerns and explain the importance of healing wound first. So patient must be asking something, oh, I'm really concerned. So usko कहना है कि don't worry, I really understand that it is a big thing, and having a mark on your forehead is definitely a thing to be concerned, but you don't have to worry. First of all, it is important that your wound should be healed. अगर इसका टास्क हम पेशेंट का टास्क उठाएंगे तो पेशेंट को टास्क में ये दिया होगा कि वो अपने परमानेंट मार्क्स को लेके परेशान होगा, और नर्स आई थिंक दिस मार्क्स आर गोना स्टे फॉर एवर, इट विल स्पॉइल माय पर्सनालिटी, आई एम रियली वरीड एंड दिस एंड दैट. सो यू से डोंट वरी, आई अंडरस्टैंड these concerns and these concerns are really genuine. You are nothing wrong in having these concerns, but I must tell you that first of all, wound should be healed. You know, wound is the first thing that should heal. Then we will say what is the progress and how much is the recovery. So outline the things he can do at home to enhance the recovery and minimize scarring. Keep it moisturized. So now I would like to tell you about few things that you have to do back at home. So first, I have already told you, मैंने आपको पहले ही बता दिया that you need to take painkillers and you have to take care of infection. Second thing is that to minimize scarring and to enhance recovery, you need to keep it moisturized and also keep the area covered. Use a sunscreen lotion if you are going out on sun. Aloe vera gel can be really effective, so please use this aloe vera gel, that is really effective and it has got healing properties, so it will help to heal your skin. Also take the healthy diet, like you should to take more of green vegetables and fruits, which always will keep you hydrated and will help you to recover faster. And also keep drinking water. So hydration can be terms of drinking water. Please avoid teas and coffees in this particular duration because they will not help in early recovery. So it's better to take more of water, keep yourself hydrated. Eat fruits because fruits also have water content. Few fruits like apples, pears, they've got a lot of water content, so please have these. Oranges and all those things will help you in the healing process. So these things will help you. And now I would like to reassure about scarring as well. As you mentioned earlier that you have concern regarding the scarring, I truly understand, but as I told you earlier as well, healing would be the first thing. And for the scar, they will fade away with time, so more time will pass by. It is an automatic process that body heals, so most of the scars will fade away. And there are preventive care of the wound at home to reduce the scarring. So here another, if a scab develops, do not if there is any problem, like if a scab develops, please do not pull it. Plenty of cosmetic treatments are available after the burn as healed in about 3 to 6 weeks. Dermatologist to offer more information about wound has healed. So 3 to 6 weeks. So it will take around 3 to 6 weeks for your recovery. And there are plenty of cosmetic treatments. If sometimes there are few bit of scars which are left, अगर कुछ scars रह जाते हैं, if few bit of scars are left, don't worry. Then we will refer you to the dermatologist after like 3 to 4 weeks, and he will offer you more information. But of course, after the healing of the wound. So first we are looking about the healing of the wound, and then when it happens, then you can do this thing. Ask the patient to come back in 2 weeks time. Now it is important for you to come back after 2 weeks. We have done the dressing, we have provided you the pain reliever, we have applied the ointment, so everything seems fine. Now you can go back home. And as I have told you about these precautions, so I'm giving you a leaflet. This leaflet has all the information about the precautions that you need to take at home, and also the things that you have to done at home, like moisturizing, applying sunscreen, aloe vera gel. So everything is written in this. Also this contains a chart which has got healthy diet routine as well, that what kind of fruits and vegetables you should eat to which will help you in early recovery. Also it talks about hydration as well. So it is up to you whether to speak the last line or not, but in my case I would like to summarize it again. So I will talk about this leaflet has got everything. See, here is the hydration thing that is given. So you can read it from the chart. You can read about a healthy diet. Also, it contains about the information about the aloe vera gel, sunscreen. So you are getting everything. Ask the patient to come back in 2 weeks. So now I have read the information with you. If I have to speak generally, then I will speak like this. Then in the exam, I will have few words, few in the exam. Now I have read the topic. So this, I have understand this. So I will say likely treatment. First of all, I will provide this discipline. My first point would be this injury. Second point, then I will say this. Then I will say concerns. Don't worry. Then यहाँ पे patient concerns पूछेगा. अगर वो नहीं पूछेगा, so I will not talk about this thing. I will omit this thing. I will tell about the importance of healing wound first. So ये automatically, but then I will not talk about this. अगर examiner participate नहीं कर रहा और उसका कोई concern नहीं है, तो मैं क्यों बोलूँगा इस बात को? I will not say this thing. So now my topic becomes, if I have to speak the whole topic, Good morning. My name is Dr. Bhupesh. I am your doctor for the day. आपके केस में I am this and I'm charge nurse for the day. So how can I help you? Oh, nurse, can't you see my forehead is having burns? You know, I've accidentally spilled water over me. And please, what are you doing? Why don't you just provide me treatment? I need immediate attention. See, please calm down. I assure you for the best services, and I can see your burns. So the first of all, I need your consent to provide you the treatment. That is, first I have to give you an analgesic injection and to apply ointment to prevent these burns. Well, nurse, then what are you asking for? Just give me this treatment immediately. Of course, I am giving you this treatment immediately. So first of all, I am applying the analgesic. I am giving you the analgesic injection now to relieve your pain, and also an ointment to prevent any kind of burns or scars. Okay, so now I have given you the treatment, first aid treatment. So now, as you are better, you must be feeling better now after the injection and things. I would like to ask you, like, how did you get this injury? How did it happen? Oh well, nurse, this and this happened. I was doing this. Okay, now you need to take care of two things. First of all, to prevent any infection, I'm covering it with gauze. So please take care of this thing for the moment. And also, I'm giving you few painkillers that you need to take at home. But nurse, I'm really concerned. Things are really not good. Like this gonna leave me a permanent mark, and I'm really worried about it. See, you don't have to get worried. First of all, we should think about wound healing, because wound healing is the first thing. So it will take approximately 3 to 6 weeks. So we need to wait for 3 to 6 weeks until your wound heals completely. Once your wound will heal, then things will be better. And it's all good. I will tell you few things that you need to do at home that will help you in early recovery, that will really enhance your recovery and minimize your scarring as well. So first of all, keep it moisturized all the time. So it is important to apply moisture after like 3 4 hours. Every 3 4 hours you should apply it, and keep the area covered, because if you will keep it uncovered, there are high chances of getting infected. And whenever you are going out in the sun, please use the sunscreen, and applying aloe vera gel would be highly beneficial too. And also, see, it would be really you would be really glad to know that healthy diet and hydration also will play an important role. So the more water you drink, the better you will feel, the better hydration it will give to your skin, so your wound will heal faster. And also it will prevent the scarring. And also it is very important to take healthy diet. So eat lot of fruits, especially oranges. It contains vitamin C, that's going to help in the healing process quickly. So other things like almonds, these things have vitamin E, so these are really good for skin. So please take healthy diet. You need to take more of nuts and more of other things, including the fruits and vegetables. They will help you in healthy recovery. And talking about the scarring, as I have already told you, you know that it's going to take around 3 to 6 weeks. So scars might fade away by itself. Maybe you won't have any scars with good diet and other things. But in case if there is any scab, please do not pull it. And also, there are plenty of cosmetic treatments which are available in the modern medicine. So we will refer you to a dermatologist. He's going to help you with the cosmetic treatments. He's going to provide you every option that he has if there is any kind of scarring left. So you don't have to worry about anything. You would be getting everything which is required, and you would be having all these options, and you would be feeling fine. And last but not the least, now I'm giving you a leaflet as I have explained you all this information. So first of all, this leaflet contains, sunscreen information and aloe vera gel, that how much and at what time you should apply these things. Also, it contains information about the healthy diet, that how to take healthy diet, and what kind of diet would be beneficial in healing. Like I told you about the almonds and stuff, the nuts and more of fruits and vegetables, and glasses of water as well. So this leaflet will help you. More importantly, you should visit us after 2 weeks for the review, so that we can see how much progress has been made. So if there would be everything would be all right, so it would be great. And if there is anything, then we will try to change your diet, we'll try to change your supplements, or maybe we'll give you some extra supplements for the faster recovery. But at this moment, it's important for you to have the painkillers whenever you feel pain. And please do not take stress. Stress hampers your healing. So please, try to hold yourselves, hold your nerves, and be positive, and this will really help you. So you talk about all these things, and this really help you to get going. So this is Dr. Bhupesh once again from Dr. BKM Institutes. Our contact number is plus 917696734256. and we are exclusively providing online coaching. So please contact us if you're thinking about OET coaching, and do not go haywire. Again, if you're taking any offline, so we are not providing any offline coaching at the moment. So do contact us to make it sure that you are going to the right institute. Thank you very much. This is Dr. Bhupesh from Dr. BKM Institute.